HMPV, a new virus is detected in China, and this is spreading very rapidly, affecting everyone. So the hospitals are overflowing in China. Hospitals are overflowing with the patients. This is very rapidly spreading. Mainly, it is affecting small children. So again, even in Bangalore, so recently 2 cases were detected in a private hospital. A 3 months old child as well as a 8 months old child is affected with this HMPV, same virus. Does this virus trouble human beings like COVID? These are all the certain questions which are being discussed in social media. So what is this HMPV virus? It's a simple virus. It's called as human metaneurovirus. This is not a new virus. No virus is a new. So the nature created virus first than human beings. And this virus, HMPV virus, even though it is being detected in 2001, it was there thousands of years before. Is it a rare infection? Again, this is a very common infection. So when there is a change in weather, especially in cold weather, this virus keeps multiplying and causes infection. That means to say, every year when we get infected with the virus, we won't test, but if we test previously last year or before that, when we got infected with any virus, if we test, that could be HMPV viral infection. So 50% chances every year, there is 50% chance of getting infected with this virus. Does this virus cause complications? Again, this causes only a simple infection, no complications at all with this virus. Then what are the clinical features of this infection, HMPV viral infection? It's a simple viral infection. Unlike like common other infections, viral infections, the patient will have fever, cold, cough, then throat irritation, so body pain, sometimes even the throat pain will also be there. No other complications, even the breathlessness will not be there. But in case of any viral infection, which infects the lower respiratory tract, it may result if the patient is having a low immunity. In case of immunocompromised patient, he may develop this breathlessness. But again, this is not common with HMPV virus. Is there any medicine for this virus? Again, we don't need any medicine for this virus because it's a self-curing. So it's a self-limiting disease. In about 3 to 5 days, our body produces the antibodies and this virus dies within us. So we don't need any medicines. Again, we don't have any medicines, we don't have any specific medicines to treat this virus. Then what to do? What are we supposed to do? What precautions we are supposed to take? Coming to this mask, the mask will have the pores which are larger compared to the virus. Virus will be very tiny, very small. It can easily pass through this some mask pores. So mask is of no use. Sanitizers cannot kill the virus. So sanitizer is also of no use. Then what should be done? First thing is avoid going to the hospitals. So because hospitals are the source of infections. So many people, many patients will be coming to the hospital. Many are infected with many viral infections. So if you go to the hospital, even though you are healthy, you may get infected with any viral infections. So first thing is avoid going to the hospitals. Sometimes even when you go to hospital with some other diseases also, you may be wrongly diagnosed as having this HMPV viral infections. First thing is avoid going to the hospital. Second thing is avoid testing. It's a self-limiting, self-curing disease which doesn't have any medicines, which gets cured on its own. So no test is necessary. Whatever the test they are doing, it's a non-specific test. It's not an HMPV test. It's a non-specific test which is being done for RNA virus. So even if you are diagnosed as a HMPV with a test again, it may be wrong. So no need to go for any test. Third thing is, if you don't have symptoms, don't bother about any precautions. And if you have symptoms like cold, cough and fever, then take a rest. Instead of going to the hospital, take a rest because rest is the best medicine. And if you take a rest within a 3 to 5 days, this gets cured on its own. Are we supposed to take any medications? We don't have any specific medicines for this virus. And if you have symptoms, even if you have symptoms like cold, cough and fever, if it is mild to moderate, better to avoid medications because this cold, cough, fever itself, the body produces the symptoms to subside or to suppress the viral multiplication. So if you have mild cold, fever and cough, then avoid symptomatic medicines also. And if you have severe fever, 103, 104 temperature, high severe cough and severe cold, intolerable cough, then only you can take a symptomatic medication. Then how to improve? No, only way to get cured of this viral infections is to improve our immunity. How to improve immunity? Immunity can't be improved going to the hospitals or taking any medications. Stay at home, have healthy food, healthy vegetables as well as the fruits. If you take a plenty with plenty of water, that itself is will improve your immunity. Final and the best advice, best precaution what you can take about this HMPV virus is stop collecting the information about this virus. Stop listening the news about this virus. If you need a precise and scientific information about health, then only you subscribe to our channel. Namaste.